What is mesothelioma? Today, we will examine everything you need to know about this disease, including its development, diagnosis, and the most common treatment options. Finally, we will also share some doctor tips that may help improve your survival rate. Mesothelioma is a rare cancer caused by exposure to asbestos. This cancer typically develops in the soft lining around the lungs, abdomen, or heart as a result of prolonged asbestos exposure. Most people diagnosed with mesothelioma come in contact with this mineral through their job or workplace. Workers can accidentally expose loved ones by bringing home microscopic particles on their clothes, hair, and body. Asbestos was also a common building material in most homes and buildings before 1980. Friends and family members can come in contact with asbestos fibers during careless home or office renovations. When microscopic asbestos fibers are inhaled or ingested, they can become lodged in certain vital organs such as the lungs, abdomen, heart, and testes. These fibers can then travel from your organs to the soft lining around these organs, where mesothelioma tumors are formed. The same qualities that made asbestos valuable as a nearly indestructible material also prevent our immune system from destroying it. Asbestos fibers damage DNA in the fragile cell linings around your organs. The damaged cells no longer experience the typical cell death, and as a result, they continue to replicate. Eventually, they create a mesothelioma tumor. Now that we understand how mesothelioma cancer develops inside the body, we can discuss the most common symptoms that affect people with a history of asbestos exposure. Mesothelioma has an unusually long development time, and it normally takes 20 to 50 years after exposure for symptoms to appear. The most common mesothelioma symptoms include dry cough or wheezing, shortness of breath, respiratory complications, and pain in the chest or abdomen. Other symptoms include fever or night sweats, pleural effusion or fluid around the lungs, fatigue, and muscle weakness. Unfortunately, many of these symptoms are very similar to those of other illnesses. It is common for patients to be initially misdiagnosed with other conditions before receiving a mesothelioma diagnosis. Dr. Jacques Fontaine, a mesothelioma expert and thoracic surgeon at Moffitt Cancer Center, will explain more in detail. Dr. Fontaine, what are some of the symptoms and diagnostic challenges associated with mesothelioma?
The symptoms for mesothelioma are very tricky because there's a lot of conditions that mimic mesothelioma. The most common symptoms of mesothelioma are shortness of breath and chest pain. However, the most common reason for shortness of breath is not mesothelioma. You can have an infection that causes fluid buildup in the lung. You can have a pneumonia that gives you chest pain and shortness of breath. So all these symptoms are much more common in other disease states rather than mesothelioma. And that's one of the reasons why mesothelioma is so difficult to diagnose early on.
Thank you for that unique and valuable insight, Dr. Fontaine. Now, let's discuss the difference between the four main types of mesothelioma and how each type can impact the recommended treatment plan. The four most common types of mesothelioma include pleural mesothelioma, which develops in the lining around the lungs, peritoneal mesothelioma, which forms in the lining of the abdomen, pericardial mesothelioma, which spreads in the lining around the heart, and testicular mesothelioma, which emerges in the lining covering the testes. Because each type develops in a different location and around different organs, the recommended treatments will change to give patients the best chance at increased survival. The best approach for treating a rare cancer such as mesothelioma is to use all available and eligible forms of treatment. The multimodal or multimodality approach, which combines 2 or more treatments, including surgery, radiation, and chemotherapy, is the best strategy. Doctors have used this combination for improving prognosis and extending life expectancy. Dr. David Sugarbaker, a pioneer in mesothelioma treatment, will explain more about multimodal therapy.
When we discuss the treatment of mesothelioma, patients often hear the term multimodality therapy. Indeed, our first approach back in the early 90s was to treat patients with multimodality therapy. Actually, we were one of the first to actually put different modalities together for the treatment of patients with mesothelioma. We were trying to define what was the best combination to remove the tumor and then mop up, if you will, with the types of treatments that could do that at that time. Now, multimodality treatment, therefore, is looking at different modalities, surgery, radiation, chemotherapy, and now immunotherapy, put together in a variety of different sequences in order to treat the patient's tumor.
As a quick recap, we have learned about how asbestos exposure leads to mesothelioma, its most common symptoms, the challenges associated with the diagnostic process, how mesothelioma types affect treatment, and how multimodality therapy can give patients the best chance at fighting this cancer. Our final topic is practical tips patients can use to extend their survival. To do that, let's again ask Dr. Fontaine about the advice he gives his mesothelioma patients.
People come and ask me, what can I do? I was just diagnosed with mesothelioma. What can I do to improve my chances? I tell them 3 things. 1 is exercise every day. Get up and walk. The more you walk, the better it is for you, both physically, also mentally. Second thing, high protein foods. That's the best diet you can do. Proteins are the building blocks of your muscles and of your body, and you want to have the best nutrition to be able to handle the treatments. And the third thing, even more important than nutrition and exercise, is attitude. If you have a positive attitude, then there's a chance that you can beat this cancer. But if you go start this fight already losing, you'll never make it. That's why a positive attitude goes a long way, much more than any nutritional supplement, much more than anything else, a positive attitude. And that comes from within, and that comes from the people around you.
Thanks again, Dr. Fontaine. As with any medical or health information you read, always ask your care team about the tips in this video before trying them yourself. We hope you learned more about this rare cancer and took away some knowledge to help you or a loved one diagnosed with mesothelioma. If you have any questions or want to know more about any of the topics covered today, please give us a call using the number at the end of this video, or leave your questions in the comments below. Thanks for watching.